Hemostasis literally means stop blood or stop the bleeding. It's a fast series of reactions, and we're trying to stop bleeding when a blood vessel ruptures or if the wall breaks. We need a lot of clotting factors and substances, which we're going to go through. These are mainly proteins that exist in the blood and in the tissues, and substances released by the platelets themselves are needed as well. So hemostasis will exist in 3 steps: vascular spasm, platelet plug, and coagulation. So our job here in this video is to go through these 3 steps of hemostasis. Step 1 is vascular spasm. So when a blood vessel ruptures or is injured, the smooth muscle in the wall of the blood vessel contracts, which constricts that vessel. We call that vasoconstriction. How does that smooth muscle contract? Well, the direct injury to the smooth muscle, as a reflex, it'll contract. There's chemicals in the endothelium, which is the inner lining, that's released if it is torn, which causes the contraction, and pain causes the contraction as well, which is a significant event to reduce blood loss for about a half an hour. Step number 2, platelet plug formation. Remember, these tiny little platelets here can slide along the walls, the inner wall of a blood vessel, because of the chemicals released by that inner wall. However, when that vessel ruptures, now the collagen fibers are exposed, and which are sticky to platelets, and they start adhering. And also, platelets become activated, they swell, they become spiked and sticky by the by the chemicals released in this torn area. Also, the platelets will signal to other platelets to come join in and adhere to this area as well. So as they become sticky and as they attach to collagen, other platelets start sticking to them, so you get this positive feedback amplification of platelets rushing to the area, sticking together, and forming a plug to seal that ruptured area. In step number 3, the most complicated step, coagulation, we have fibrin proteins that form this mesh that traps the red blood cells and platelets to form the clot. So we already had the platelet plug, now we have this fibrin that is created during coagulation. We'll see how on the next slide that acts as this sealant, especially in larger breaks. So for that to happen, there's a series of reactions using clotting factors, proteins that exist in the blood. When something like this occurs, it's mostly plasma proteins. These factors are numbered 1 to 13 in Roman numerals, because there's 13 of them, just in the order they were discovered, not because that's the order they come into play. And we need vitamin K to synthesize these factors, but let's go ahead and look at this process. So step 3, coagulation, step 3 actually has 3 phases to it. So the third step has 3 phases. This is the first phase, which looks complicated and overwhelming. Remember, these are all the clotting factors with Roman numerals. Don't get too hung up on all of this middle stuff right here. Let's just look at the beginning and the end of phase 1. So at the beginning, there's 2 pathways, which typically happen at the same time, but are independent of each other, but related. The intrinsic and extrinsic pathway. The difference is, intrinsic, the signals or chemicals will come from the endothelium, the inner lining, intrinsic, where the extrinsic pathways will begin with chemicals from the tissue itself inside the vessel, right? So which you call these tissue factors. But whatever the start of this process is, one clotting factor acts on another that activates it into an enzyme, which acts on another reaction, which becomes an enzyme, acts on another reaction. So we have all these reactions occurring, creating enzymes which will act on another reactions or catalyze another reaction. So it's this cascade of events, especially the intrinsic pathway, here's the extrinsic pathway, but you can see the end result is the same. We're forming, at the end of phase 1, we form something called the prothrombin. Remember, thrombo means clot. Prothrombin activator. Phase 2 is not quite as complex. This is how we create thrombin. So what happens is this prothrombin activator, which becomes an enzyme when it's activated, catalyzes another reaction from prothrombin, clotting factor, becomes thrombin. That's phase 2. And finally, phase 3 of coagulation, the thrombin that was created in phase 2 will convert fibrinogen, which is soluble. That means it's dissolved in the blood plasma. Thrombin converts fibrinogen to fibrin, which is insoluble. It's like a gel. So this liquid fibrinogen gets converted into this fibrin gel, and look at it. It's like a net or a mesh, which will adhere to these platelets that are all sticking together and help form that blood clot. So there's your 3 phases of step 3, coagulation. When blood vessels are not injured, so under normal circumstances, we have anticoagulants. They inhibit coagulation, so under normal conditions, anticoagulants dominate in the blood because we don't want blood to clot if it doesn't have to. But when a vessel is ruptured, these procoagulants then increase dramatically in that area. Not anti, but procoagulants, all the chemicals and substances we just went through, and a clot will start to appear usually within about 5 minutes or so. Now the clot has formed, and it needs to be stabilized. So first thing that happens now is clot retraction. The platelets start to get squeezed in with the fibrin. So think of it as like bringing out a sponge where this fluid gets released from the clot. That fluid that comes out or gets squeezed out is serum. We haven't mentioned what serum is. What serum is plasma without the proteins. Remember, plasma is filled with clotting proteins, but if we just remove the fluid from the clotting proteins, now we have serum, so that's getting squeezed out. Clot is drier, so to speak, and that stabilizes the clot. And that's going to remain until the tissue repairs itself, which takes time. It could take a couple days or more, but that clot will eventually be removed. That's called fibrinolysis. Fibrin, the net or the mesh, lysis, rupture or remove, fibrinolysis or fibrinolysis is accomplished by plasmin, the enzyme that's going to break down the clot once the injury has healed. I just want to finish this video but with a point that I mentioned a while back, is that what inhibits clots from forming when we don't want them to form under normal condition is that inner lining of a blood vessel that's going to secrete nitric oxide and prostacyclin that allows platelets just to smoothly slip along the capillaries or the blood vessel without any impedance. It's only after a blood vessel is injured that it gets sticky, mainly because of the collagen that's exposed from the inner tissue.